Bonjour. Okay, Tamanu is a free and open source electronic health record for low resource settings. It's a digital square global good for health, and it's implemented in 6 Pacific Island countries, including being the national system in 3 of those. Now, the Pacific Islands, they are some of the most beautiful settings in the world, but they're also some of the most challenging to deliver good healthcare and to implement and sustain digital health solutions. Tamanu was really designed to help overcome those challenges. So the first one is obvious: infrastructure. There's poor internet connectivity, particularly at remote primary care health facilities, but also often at the referral hospitals in the capital cities as well. So systems that are web-based are often not suitable for this context. Tamanu is sync enabled. That means it works offline whenever the internet is down, and it will automatically synchronize data to and from the central server whenever internet becomes available, even if that's only just for a few minutes. The second challenge is financing. So these are very low resource settings. So expensive ongoing licensing fees associated with commercial systems are often not sustainable long term, even if a development partner is supporting the initial implementation. Tamanu is free and open source, so there's no mandatory ongoing licensing fees. There are optional support and maintenance fees that countries can opt to be a part of, but if they don't pay those fees or they choose not to be part of it, the system is never cut off. And importantly, that can never change due to the licensing model. So there's a real shift in power dynamics from the solution provider to the country. Health systems in the Pacific are very geographically dispersed and isolated, creating huge challenges for continuity of care. Tamanu is desktop and mobile enabled, so that means you can use the same system all the way from community to primary, secondary and tertiary care. So the mobile system can be used for things like a community outreach program for immunisations or NCD screenings, while the desktop version can be used in more complex settings such as hospitals. So it's really supporting this development of a birth to death record, supporting continuity of care for patients. Health systems in the Pacific and many other low resource settings are really saturated with fragmented digital health solutions that don't speak to one another. This is really challenging for health workers in the Pacific who tend to wear many different hats. So it's the same nurse that's doing NCD screenings one day, an immunisation program the next. So the idea that this health worker is expected to pick out a different app for each different clinical condition or public health program that they're managing is really not sustainable in the context. So Tamanu provides a single app for all clinical and public health encounters, really helping to reduce the burden on the health worker. It also has an HL7 FHIR compliant API, meaning that it can integrate with other core digital health systems like your lab system, supply chain system, DHIS2, or Tupaya, which is our app for data aggregation, analysis and visualization to support data for decision making. And finally, it has a really nice, modern, clean interface, making it easy and intuitive to use for health workers, particularly important for a workforce often with limited digital literacy. And it goes without saying, there's comprehensive security with data encryption to protect the highly sensitive health data being captured. So I'm going to conclude with the keys to success in scaling Tamanu at a national level in the complex Pacific Islands. I've spent a lot of time talking about the principles behind Tamanu, and that's because they are a must, not a nice to have in the context of the Pacific Islands, and I would argue also for other low resource settings who face similar challenges. But of course, the software is just one part. You also need an implementing partner that deeply understands the context. We do this in several ways, one of which is first and foremost by employing Pacific Islanders on our projects and working with Ministries of Health to transition those roles into permanent Ministry of Health positions later. We would really love to explore partnering with other organisations that deeply understand other contexts, such as those in Southeast Asia, Africa or Latin America, to see how Te Manu might be appropriate for those settings. And finally, many Pacific Island countries and many other low resource settings are still putting together the building blocks for digital health. But if you wait for all of the building blocks to be perfect before you start implementing core systems like a national electronic health record, you will wait forever. So in our experience, we've really sort of flipped to this paradigm and have been introducing Te Manu alongside the building blocks. And what we've found is that once you introduce a system that delivers real benefits, tangible benefits for clinicians and health workers, this helps build momentum and enthusiasm for the building blocks, which are critical, but often more difficult to garner support for. Merci beaucoup. Thank you, and come and have a chat later.